During that visit, which is now 6 weeks post-operatively, we'll actually be asking what your urine stream's like, how many pads are you using, but more than that, we like to know how you're dealing with the situation yourself. Are you frustrated? Are you coping? And we like to, again, spend time with you so that you feel that all your concerns are certainly addressed in an appropriate way. We find often that the wives attend these visits, and it's often good to be able to give them information as well. Associate Professor Rashid always pops in at these visits, and again, if you have particular concerns that we need to address to him, then he's here to answer those as well. And from that time on, you generally get seen quite regularly by Associate Professor Rashid. During your months of recovery post-radical prostatectomy, it can for some men take some time for their continence to return. Some men at 6 months are feeling a little frustrated that things aren't as good as they could be, and we'd like to advise you to be patient and that you can come and talk to us or ring us on the phone should you need to. It's interesting that many men feel that we need to jump in and do something to rectify it quite immediately, but we like to advise people in this situation that we like to wait for at least 12 months because that allows the time for the body to heal itself, and in probably 95% of the cases, most men will find that their incontinence is improved or at a level that's acceptable at the 12-month period. During that time, we're here for advice regarding perhaps different pads or different kinds of pants that you can use to contain any leakage that you may be having. But I assure you that this is the minority of patients, but that we are here for you to consult should you need to. If your continence does not improve to a level that we desire, there are things that can be done surgically or medically, and it's at around that 12 to 18 months mark that we encourage you not to suffer in silence and feel that you need to live your life with this problem. I guess one of our main messages to our men is that we really encourage you not to suffer in silence if you have any concerns, but particularly with incontinence, as it's such an embarrassing and limiting problem. Please come and see us, and we can organise an appointment with Associate Professor Rashid to discuss options to help you cure or at least manage this problem much better. For most men at around the 3 to 6 month post-radical prostatectomy, the bladder has started to settle down, they've recovered physically well, and it's probably around the time that men are starting to think about their erectile function. Dr. Rashid has usually organised at this time for some oral tablets to be tried, but it's always excellent to know that you can come and see the nurses, because taking a tablet isn't just as easy as it sounds for erectile dysfunction. You need to be informed that you need to try these tablets on a number of occasions, that they have various side effects and we can optimise their benefit. If tablets don't work for you, then it will be suggested that you perhaps use what we call intracavernosal injections, or injections for erectile dysfunction into the penis. This is quite daunting at first, but again, if you and your partner can come and talk with the urology nurse here, you feel that your questions may be answered more fully, and we actually go through the process of how to inject yourself safely and efficiently. For those men who perhaps oral tablets and injections don't work, there is an option of a vacuum pump, but this is not satisfactory for some men, but there is a more permanent option available. This is called a penile implant, and fortunately Associate Professor Rashid is able to insert these for you. Again, we would organise an appointment with Associate Professor Rashid. He would go through the procedure with you and any care that you need to know of that equipment. And once again, if you have further concerns once seeing Dr. Rashid, you are very welcome to make an appointment with our nurse and you can discuss it even further. If you decide to proceed to having something more permanent, such as a penile implant, we want to encourage you again to know that we're here as a resource person, and that both the nurses and Associate Professor Rashid are available to see you through this next part of your journey. I think for some men, sometimes the pelvic floor exercises seem something minor, and how efficient are they? But in our work as urology nurses here, we have seen profound benefit from doing pelvic floor exercises, particularly for return of their continence. So this is a big part of our education process here at the centre, not just for radical prostatectomy, but for many forms of incontinence. We're quite well versed in pelvic floor exercises and how to perform them correctly, and we're here to advise you and educate you in those regards.